manufacture, yes, I entirely agree with you. As I said, there's a company in Lagos. They are in the process of manufacturing antiretrovirals from generics. They are partnering with the largest generic company in India. I don't know how far they are going to go in terms of manufacture, because when you talk about manufacture, you could have just packaging, but I think they're going to do more than just packaging. And certainly, if I'm a businessman, I would say I would have gone into HIV, because it's a problem that's going to be with us at least for the next 50, 100 years. You will still need people taking the drugs. And why is it profitable? It's because unlike drugs that you take for, let's say, respiratory tract infection, pneumonia, you take it for 5 days, gone, finish, you carry on with your activity. These are drugs you continue to take for life. They're just like statins. Statins have one of the highest profit margins ever, because once you take them for cholesterol, you continue taking them. So also HIV drugs, once you start taking them, you continue taking them for life, and there will still be a need for those drugs, at least.
So just a follow-up. Now, if you bring an HIV patient and give to a traditional medicine man, let's call it that way, and he treats the person, and you test the person as a scientist, and there's zero HIV, how would you promote that traditional medicine man?
I think that's a theoretical question that at the moment has not even arisen.
Okay, as a scientist now, let me take you up on this. And it still revolves around the issue of cure. I was made to understand about the various strains of the virus and how it differs from one location to the other. I was made to understand that for instance, in Nigeria, you could have a strain A or B, that could be different from the one found among the people in South Africa. So how do you reconcile that in the quest for vaccine?
So yes, so you're quite right. Excuse me. We have what we call subtypes, and those subtypes relate to geographical locations. They have nothing to do with transmission or the ability to cause disease. So in terms of pathogenicity, they're actually very similar, but they are subtypes, and it's useful to know them, because if I have a patient with a particular subtype in the UK, for instance, I can tell him, I think it's very likely maybe you picked it from Nigeria, for instance, or from this part of the world. Vaccines are important when it comes to designing subtypes are important when it comes to designing vaccines, but there's also a way, because a lot of vaccines do not just rely on one subtype, because remember, the manufacturing companies themselves are doing this for a profit. They are not just doing this out of humanitarian reasons, apart from Gates Foundation, of course, etc. So whatever vaccine they design should really accommodate the common strains, and Nigeria has the second largest HIV burden in the world. I don't see any vaccine being produced that would exclude the strains circulating within Nigeria. The strains circulating within Nigeria include the CRF, the common recombinant strain, which is a mixture of 2 or more strains. I know there are some concerns from certain quarters that the vaccines that are currently being pushed into phase 2 trials do not cover the strains, but I'm sure over time that concern will be addressed.
The strains are found in Nigeria?
No, yeah, they don't cover the main strains that are found in Nigeria, but they have to start from somewhere at the end of the day, and I'm sure they will find a way to involve them. Certainly, we're pushing from the point of view of NACA and our partners to make sure that whatever they do, which I am sure they would include, because it doesn't make sense to do a vaccine that would cover HIV patients in a part of the world that don't have a problem with HIV. They won't.
Dr. Sani Aliyu, as we round off, it would be nice to hear from you, someone who started his medical training in Nigeria, you crossed over and you made a mark. How can, using those two experiences, how can we increase the access to affordable health care to larger percentage of population across the country?
Well, it's interesting. Certainly my Nigeria experience, I've only been in this job for about 3 months, and I can say it's interesting. And you can see clearly how systems differ from one country to another. I had the advantage of working in a resource-rich environment. Nigeria obviously is resource constrained, but from the way I see it, it's the pyramid that we probably should address. Most of the healthcare issues are at the primary healthcare level. They are not at the tertiary healthcare. Very few people actually access tertiary care. If you want, the biggest impact you can have on a healthcare system is going to the primary healthcare and sorting it out. And I'm very pleased the current minister, the Honorable Minister of Health, has already started the process of renovating primary healthcare centers. And NACA, as an organization, we are committed to making sure that for every Primary healthcare, they renovate. We go in and provide capacity building skills for the staff. They're not only for HIV but also for TB, and we'll also partner with our own partners to make sure that there are treatment sites for HIV. So that's one of the first things that needs to be sorted out from the context of HIV. Transparency and accountability is also very important within any system, including healthcare as well. The cost, a lot of the cost that we currently have, I believe if we have very transparent systems, we can actually cut the cost of delivering healthcare substantially. And I know the current anti-corruption stance of the government is really helping us in this regard. The more we can cut waste, the easier it will be for me to approach state governors and say, I just want 30,000 naira per patient per year for me, or HIV patients, you have this amount of patients, and please can you give me that money so that we can deliver care. Transparency is important. There are other parts of the health system that also need to be sorted, like the logistics side. In the UK, for instance, we have a central logistics where everything is procured as a pool, so you cut costs because you are able to negotiate effectively with suppliers because you're buying in bulk. So Nigeria should be able to buy their drugs, not only HIV drugs, everything, all the essential medications, pool them centrally, and then have a very good distribution system, so that when I have a need for antiretrovirals in Sokoto, NACA will just call the central system and say, can you deliver 10,000 packs of antiretrovirals to Sokoto? How you do it, not my business, but it needs to be done. Because if we have the right commodities in the right place and the right people to deliver those services, we will get the answers you want.
Dr. Sani Aliyu, certainly we may have to stop somewhere, and we are stopping now. It's a conversation that will continue, certainly. We will see more. We will wish to assure you of our level best of advocacy, support towards your advocacy, and we also want to see how far NACA can go in coming up with that fund that you are advocating. Dr. Sani Aliyu, Director General, National Agency for the Control of AIDS, thank you so very much for coming on platform.
Thank you, Mohammed. Thank you for having me.
Kiran Umayo, Head of the Science Desk, NTA.
It's my pleasure.
And of course, Rabi Abdullah, our semi-expert on health.
My pleasure. Thanks for having
Head
me.
of the NTA's Health Desk. Thank you for all your thoughtful questions and insights. Platform had examined the challenges of access to affordable quality healthcare by ordinary Nigerian citizens. The edition also discussed the likely donor fatigue with respect to HIV and AIDS national response, with our guest, the Director General National Agency for the Control of AIDS, NACA, Dr. Sani Aliyu, says is now 70% dependent on foreign donors. But he has brought forward so many possible suggestions that the federal government, the Federal Minister of Health, and of course the National Assembly should look into as a way forward. That's Platform. My name is Muhammad Kuda Abubakar.